that takes us very nicely onto Doctors for Choice. Doctors for Choice have been very active over the past number of years in campaigning on that very issue of accessibility, of ensuring that women actually get access to abortion. And I think their voices in the debate has been very, very important in articulating the medical perspective, but also in ensuring that no additional obstacles are put in the way in terms of women accessing abortion. So we've got two speakers from Doctors for Choice who are going to divide their time. Dr. Marion Dyer, who is a general practitioner with a particular interest in women's health. Marion is also an assistant professor in the Department of Public Health and Primary Care at Trinity College. And we also have Dr. Padder Grady, who's one of the founding members of Doctors for Choice, who is a consultant child psychiatrist.
As Sinead said, my name is Marion Dyer. I'm a GP. This was my first slide, and I thought you might be very happy because this could be a really short presentation. But I suppose I should tease it out a little further. What do women need? We obviously need to have the 8th Amendment repealed. I thought we might just tease out for a moment, what do women need from their doctors? And what women need from their doctors is what everybody needs from their doctors. Everybody wants to get good quality health care. And good quality health care, we would say particularly in general practice, is all about good quality consultations. The meeting, the interaction between the doctor and the person who comes to the doctor looking for help and support. Thanks, Father. When we teach medical students and doctors who are in the early stages of their career who are training, we spend a lot of time teaching them about consultations. And we teach them that in the consultation, they are expected to respect the patient's agenda. They're expected to prioritize the patient's needs over their needs in the interaction. We get them to read lots and lots of really well-respected authors like Pendleton, who taught, and this is back in the 60s, that it was no longer acceptable to ignore patients' ideas, concerns, and expectations when they came to see the doctor. That was the beginning. It was meant to be the beginning of the end of Doctor Knows Best. We now teach both medical students and junior doctors about respecting what the patient brings to the consultation and that the consultation is about meeting their needs. So a question we would ask in Doctors for Choice is, if this is what we're teaching young future medical professionals, and if these are things we will fail them on when they do role-play consultations in their examinations, why uniquely, when a woman is pregnant, do those principles seem to be ditchable? Why is it okay to throw those principles away when a woman is pregnant? And we call these proper consultations nowadays patient-centered consultations. Thanks, Father. And what Doctors for Choice has to say is really quite simple, and something that intuitively people know. Basically, what we would suggest is that, what do women need? They need the same as every other patient in every other consultation. They need patient-centered care, which prioritizes the patient's needs and the patient's view of their situation. And we need these consultations and interactions to be based on exactly the same principles of respect that we teach as a first principle of how to consult in every other medical situation. Thank you.